So common questions that patients have around sexual side effects, how they feel about their body. Obviously, one is body image, although that's not a side effect. It's one that comes up regularly. Again, whether it's scarring or the loss of a breast or the way their body looks different. For men and young men, I hear a lot when they've had to go through a stem cell transplant and then are on steroids, and then they get all these stretch marks. You can't get rid of stretch marks, and it's devastating to them when they come out of being well and now left with a body that has visual marks for them for the rest of their life. And so oftentimes, what do I do about that? How can I manage that will come up. And body image is a hard thing to address, especially in a video setting, because it's so individualized depending on the person. So for the young man who was a body trainer and he was a weightlifter and went through stem cell transplant, gained 40 pounds in a short amount of time because of fluids and steroids, and then was left with stretch marks from his knees up. We did a lot of work around just self-love and self-acceptance and the story of those marks and what strength came out of them. And also grieving that his body wasn't the same that it used to be, but that his strength, his personality, and all the other things that did work well and that were still attractive. He had an incredible smile, his eyes lit up, he was able to work a room. All of those things stayed true that were very much still a part of his sexual self, his sexual body. Other things that come up, especially for young women, are being thrown into medically induced menopause. That has a devastating effect for a lot of young women, and all things we can work around, but definitely challenging, right? So when we turn off the ovaries so quickly, the common side effects to that are vaginal stenosis, or the narrowing of the vaginal canal, vaginal dryness, vulvar dryness, discomfort upon penetration, whether again a toy, a finger, or a penis, that the area around the vagina, the vulva, can get very tender for some. It may be totally not sensitive. There may be a tightening, or in that vaginal stenosis, the narrowing, which feels like, women would describe it to me as, it feels like they're hitting a wall, that it hurts. And in that as well, the vaginal atrophy that can take place and the weakening of the vaginal muscle, along with the skin thinning, or the inside thinning, can cause some bleeding, can cause discomfort with intercourse, or even just masturbation. And so addressing that is really important. And the earlier we can address it for young women, if we know they're going to be put in a medically induced menopause, we should, ethically, I believe, be having the conversation about how to manage and maintain sexual function when we tell them that that's going to happen. And it's actually pretty simple to do. You introduce the use of dilator therapies. If they're not going to have intercourse with a toy or a penis 3 times a week, they need to be using dilator therapy. The dilator should be lubricated, inserted, and then keeping that pelvic floor muscle strong is also another really important part of that. So Kegel exercises where they're squeezing that dilator for up to 15 seconds and releasing is really important. And I call that vaginal rehabilitation, kind of like we tell them to go to rehab and PT. This is the same thing for their vagina, so that even if they're not sexually active, which someone will say like, I don't even use that anymore. Well, you may not for intercourse, but you don't want to sneeze and pee your pants, right? So keeping that muscle strong is important for more than just sexual function. It's also important for continence and overall pelvic floor health.